everyone. Welcome to This Day. It is Wednesday, November 18th. We don't have any open meetings to share with you today, so we'll jump right in to tell you who's on our show. We have two very interesting segments. We have one with the Florence Sylvester Senior Center. Cherie and Lauren tell us all about what's happening this weekend, which would be the Rummage Sale and a variety of other things that are going on with the Senior Center. Then we also talked to Jason Qatar, who is with Knowledgeable Aging, and he does have a show here on our station in which you may have watched. So we're going to talk about how he came about that show and all of his interesting content that he shares with us. Okay, let's go to our numbers, which are COVID numbers. I changed up our background a little bit. COVID19.ca.gov, where you can get all the latest plans and restrictions that the governor has put into place most recently. OCHealthInfo.com is where you can get all of the COVID numbers. And then, of course, they have a hotline that you can call, 714-834-2000. You could always go to our website, which is LagunaWoodsVillageAlerts.com, where we get all of the latest information from our Orange County Health Department and put it on our website. Or you could email us any questions or concerns, info@LagunaWoodsVillage.com. All right, the weather is looking quite lovely. We do have some fog out there this morning, so that should be burning off in a little while to a lovely 70-53. Tomorrow, 70-54. We will have some high clouds on Friday, 70-51, and a beautiful weekend, 72-52, 71-50. So we shouldn't be seeing any clouds with the exception of the one high cloud. So looking quite lovely. Now, our sunrise this morning was at 6:26, and our sunset will be at 4:46. Now look at that, yum, yum. That is a salted dulce de leche brownie. So you can do that instead of pumpkin pie. And that you can find that at SeriousEats.com. So I'm just going to keep giving you lots of ideas of all the different kinds of alternatives that you can make for Thanksgiving dessert. So there you go. If you have an idea that you'd like to share with us, please email it to LagunaWoodsVillageTV@gmail.com. All right, when we return, we are going to have Cherie and Lauren from Florence Sylvester Senior Center. We'll be right back.
Cups, plates, burgers, chips, masks, outdoor air, 6 feet of distance, as few people as possible, and plenty of hand soap. Make sure lowering the risk of spreading COVID-19 is on your list for your next small gathering.
Do your part to lower the risk.
Welcome back. Well, today I am joined by the Florence Sylvester Senior Center ladies, Lauren and Cherie. Well, thank you, ladies. I appreciate you joining me this morning.
Thank you.
Thank you.
And, you know, we were kind of talking about some things that are happening with seniors and what's going on. And Lauren, I know you're going to be addressing that in just a bit, but you've got exciting activity coming up, Cherie, the Rummage Sale. So tell me about that.
Yes, Rummage Sale is going to be November 21st, and that is a Saturday from 8 to 4. It is one of our Florence Sylvester fundraisers. As you know, we are a nonprofit organization, so we really do rely on volunteers and kind donations. So this is a way to bring in some donations. And we are accepting all donations of the knickknacks and the clothing and the shoes and all that stuff. We've had such an overwhelming response. So thank you to everyone who has donated up until this point. But you can donate on Tuesdays and Thursdays from 1 to 3. Just drive up to our building in the back, and we will have someone go out there and unload your car for you. So
What's the latest they can turn things in?
Pardon me?
What's the latest they can turn things in?
Up until the date. So the Thursday before, yeah.
Okay, perfect.
Or just give us a call.
Okay, good, because, you know, they might not be able to get there on a Tuesday or a Thursday, but, or even, you know, maybe close to date. So as long as that is still an option, that's great. Now, how are you going to handle the rummage sale?
You know, how is that going to be handled in terms of people coming out to look at stuff?
We're gonna make sure everybody has a mask on. We want it to be COVID safe. We're probably gonna sanitize your hands at the door, ask you a couple of questions, making sure you're feeling well. And then we're only gonna let a certain amount of people in at once, so everybody can practice their social distancing. And then when one person or a certain amount go out, we'll just keep bringing the people in. Yeah,
Most of the stores are doing it, you know. I mean,
yeah.
you want to go shopping, you want to do that, they can kind of roam around, and that should work out pretty well. Plus, you guys can space stuff apart, so that's perfect.
Yes.
Do you have a lot of things right now?
We do. We have 2 rooms filled with stuff. A big thank you to the volunteers who've been coming in and helping us out to sort everything. So it should be pretty well organized. So it should be a quick in and quick out.
Excellent. And that's November 21st from 8 a.m. to 12, right? Okay.
Yes, yes.
That's exciting. Something to do.
Yeah, definitely. Well, something to do. You know, clean out your garage, get rid of some stuff we're all sitting at home and you got lots of stuff. So I would say, you know, just clean it out, make a donation. And then it's a great way to support your local senior center.
I agree.
Definitely. Mm-hmm.
I think I might have a bag I'll bring over.
Please do.
I just did that the other day. So I'm like, oh, that's a great idea. All right. So you've also got a newsletter that everybody could sign up for. How does that work?
Yes. So we email it out to our everyone who's interested. It's a newsletter. It's a monthly newsletter and lots of great ideas. And it's really our way of communicating to our seniors and letting them know what's going on over here at the Florence Sylvester Senior Center, whether it's, you know, high cap and Medicare, classes that are available, brain exercise, you know, all the things that are on our website are clearly in the newsletter. And it's a great way to connect with the seniors. When we send it out, I have to tell you, I get lots of emails back. And so I feel like I'm running like a pen pal here where I'm talking back and forth to my seniors. And it's, again, a great way to communicate and let them know what's going on.
Right. And that is super important right now. Now, grab and go menu. You said you can check the website. What is on the menu?
I think my seniors like it better now that there is a menu available, because then it's not so much a surprise when they come and do the grab and go. They like that. They like to know, you know, do I want to eat the spinach lasagna, which is very good, by the way, or do I want that chicken chow mein over brown rice? It's you know, it's their choice. So they have a better control over what they're coming to get.
Where does the food come from?
It comes from a catering company out of Laguna Beach by the name of Langlois Fancy Foods.
Wow.
They've been our catering company for many years. Very healthy, very nutritious food. Yeah, it's good.
It sounds good. Yeah, lucky you get to try it.
I know. Today it's chicken cordon bleu, so how could you go wrong?
Oh, do you have an extra? I might just be right over.
Definitely.
Lauren, you know, we're talking a lot about how we take care of our seniors, and you guys do such a wonderful job. And they're sad right now, depressed because, you know, the news, you know, it's not so great with COVID-19 right now. And we were kind of hoping we were out of the woods, but we're not really out of the woods at the moment. So what kind of things do you want them to think about?
So being lonely, you know, causes depression and isolation. They say that it's as bad as smoking 15 cigarettes a day, which is really, really bad for you. So they're saying that there's, you know, stress hormones that can cause isolation and loneliness, and that it can increase your blood pressure, it decreases resistance to infection, and it can increase cardiovascular disease and cancer. So that's not good. We don't want that. Wow. So they're saying that little things that, like planning your day and keeping up daily routines, are a good thing. Getting out of bed, getting dressed, engaging in small activities, those are important to do. Technology is great. If you can get online, you can go to myagewell.org and get on classes. We do have those. We do have our grab and go program, which was mentioned earlier. You can come out and get a meal, which is great. They're also saying physical activity is important. You need to exercise. Don't and what else did they say? That's good. Being connected to your family and friends, limiting news consumption, which is what you mentioned, Lisa. You know, sometimes too much news is not good.
That's right. That's right.
Finding activities that bring you joy and keeping your mind active. I was just reading something about depression, and actually they say if you read 30 minutes a day for pleasure reading, that's really important. That keeps your mind going, and it also keeps your depression down. The CDC, you know, suggests that people social distance and isolate, but they forget that people are lonely and it's not good for them either. So that is a problem.
Well, it's a toss-up, right? I mean, we want to be safe, yet we want to be social. So and we're social creatures. There's just no ifs, ands, or buts about it. So it's really difficult. And one thing I like what you mentioned is, you know, get up out of bed and put some clothes on. Don't stay in your pajamas all day, because that is really unmotivating, I think. And another thing that I kind of like is, you know, go out. If you have your car and you're driving, go take a drive. You know, you're not around anybody and it's beautiful out. You can certainly go take a drive and drive down by the beach, or, you know, just a change of scenery might be helpful,
Exactly. Yes, very helpful. I do that on the weekends with my husband. We go for a drive because, you know, sometimes you get cooped up in the house and need to get out. So it's a great idea to do that.
Yeah. And then like you said, you know, having a plan, you know, for the day, which, you know, that's harder. I think that's easier said than done. But, you know, maybe the night before, okay, I'm going to do something that I never did, or I'm going to do something that I haven't done this week. And you just kind of plan it out. And Sheree mentioned, you know, cleaning out your closets and your garage. You know, that is a great thing, because I tell you, when you look in the garage and you see boxes and boxes, you know, it might be time to go through those. So that's a great idea. So if Lauren, if someone was, you know, having these feelings, what would you recommend that they do? Resources, you said myagewell.org, and what else?
Yes. If you want a wellness phone call, you can call us at Florence Sylvester and we can put you on the list, and we will call you every couple weeks just to check on you, just to chit chat. That's a really good thing. Also reaching out to your family and friends. That's really important, especially during the holiday season if you can't be with them. You can also, if you're able to go online, there's virtual tours of zoos and museums and things like that. Those are really important also.
Right. I especially like the animal cams, you know, because you can go and watch them. But one thing I must say, that if everybody needs a really good laugh, you got to just look up on the internet, pygmy goats in pajamas. I tell you, you will laugh so hard. I mean, I could look at that every day. It is such a crack up. So that would be my recommendation. And one other question for you, Sheree, is on the grab and go menu. Will that change for Thanksgiving?
I believe pumpkin pie is included.
Oh, fantastic.
That I do know.
Excellent. Well, man, just serve the pumpkin pie. Who needs the rest?
Yeah.
All right. Anything else, ladies?
Yeah, I was going to talk about managing holiday stress for the caregiver. So
yeah, good.
Don't think about the caregiver having, you know, to deal with their loved one and their depression for that becomes a problem many times. And they're suggesting, you know, if you're going to have a holiday gathering at your home, that you need to have it earlier in the day. Sometimes it's when your loved one is at their best, whether it's earlier in the day or later in the afternoon. If you have a spouse that has Alzheimer's, then you may not want to have them join the celebration. It's up to you, depending on how you feel, if they're going to be agitated or not. If you do bring your loved one, let the family understand to help take care of that person. And the Caregiver Resource Center has a lot of information and support and resources So if you contact them, that's great. Their number is 800-543-8312. You contact them. They have great wealth of support groups, information, resources. They're a wonderful asset to have. If you feel lonely and isolated during holidays and you're the caregiver, they can help you with certain ideas and give you connections.
That's great. And I think that's a really good resource, like you said, especially for caregivers, because, you know, we're trying so hard to take care of the patient or the person you're caring for, yet we totally forget about ourselves, who are the ones who are the caregivers.
Right.
So that's really great. And we'll have you guys on again, you know, before Christmas, and we'll be able to talk a little bit more about that and, you know, the new year and that kind of thing, because again, we're in that long holiday stretch now, and it's not, you know, and COVID's really not going away. So you combat that as well as the holiday blues, and you've got a double whammy. So excellent stuff. Thank you, Lauren. All right, ladies. Well, thank you so much. I really appreciate you taking the time.
Thank you.
And we'll keep in touch with you guys, and have a happy Thanksgiving.
Thanks,
Hey,
you
you
too,
too.
Lisa. Thank you so much.
Thanks.
All right, bye-bye.
Bye.
Bye.
And we'll be right back after this.
Welcome back. I'm Kiana Lee. Today we're talking with Dr. Christine Chung of 7-Day Dental. Today's topic is bad breath. Doctor, what do we need to know about bad breath? Mom.
Oh, sorry. Bad breath is caused by poor oral hygiene, which eventually leads to dental, gum disease, and decay. It's an easy fix.
Thank you, doctor. So don't wait, people. Come on in and get your 7-Day Dental smile.
Welcome back. Well, today I'm joined by Jason Kotar, who is here on behalf of Knowledgeable Aging. And it is a show that is right here on Village Television. Well, Jason, thank you for joining us today.
Thank you for having me, Lisa. I really appreciate it.
You're welcome. You know, we're curious as to what the show is all about, and we'll get into that in just a little bit. But before we do that, tell me how you got started with Knowledgeable Aging.
Sure. So a friend of mine told me a saying a couple of years ago that really resonated with me. He said, "You're most effective when you're affected." And for me, Lisa, that started about 2.5 years ago. At the age of 46, I was diagnosed with a form of cancer, non-Hodgkin's lymphoma.
Wow.
One of the things you realize early on is that cancer doesn't discriminate. It doesn't matter who you are, what you do, how much money you have in the bank. So for me, as I was getting my treatment, Lisa, I remember looking around the room and I saw a lot of our older individuals. They didn't have anybody with them when they were getting their treatment. They didn't have a family member, no caregiver. So my mind started racing. I'm thinking, okay, if nobody's there with them when they're getting their treatment, what happens when they go home? What about falls, making sure their medicine's getting taken care of, scams? So I started asking myself, what can I do? What type of impact can I make? To put it best, how can I find my voice?
Mm-hmm.
So what I did is I started to really surround myself with industry professionals, authors, and speakers. These folks that have spent their careers working with our aging population and caregivers. And so that's really kind of how this all started. But through the countless hours of research and communications was born Knowledgeable Aging.
Okay. So what did you do beforehand?
Real estate. I've had a master's degree in education, so every career I've ever been in has always been education-based.
Mm-hmm.
Whether you're selling somebody a home or you're educating somebody on potential impact of, a disease. This kind of falls right in line with what I've been doing my whole life. And so, like I said, when I sat down with my wife and I said, okay, what can I do? Education of some capacity, it was just a matter of where was I gonna go with it. And so, like I said, when I sat down with these professionals and authors and speakers, I knew right away what I wanted to do. It was just a matter of what was it going to look like.
Okay, so now we air your program on our station here. Is it available elsewhere?
Yes. So on our website, we have the topics, just so you know, the topics are health and wellness, legal, housing, finance, and the COVID pandemic. Now, obviously, but irrespective of the topics, we're speaking to not only just those aging population that are impacted, but also their family members. Mm-hmm. So on our website, we have 3 live webinars every week. Then they get archived. And of course, we're gracious enough or you guys are gracious enough to have us there at Laguna. So we will continue to provide these live webinars each week. And, every Wednesday at 4:30 is when we're on the air there.
Okay. Well, perfect. Yeah. Obviously 55 and over is our specialty here. And, all those topics that you've touched on, we talk to doctors, we talk to, directors, executives of hospitals, all sorts of people that really do hone in on what you're talking about. So I think that's great. I mean, we only spend a few minutes with each of them, and you have a dedicated half an hour. So that's really nice to be able to do that. Tell me a little bit about the show. I mean, maybe choose one that really stands out to you that you really liked.
Yeah, so actually it was the one that we've gotten quite a bit of feedback. So I think we've been on the air there at Laguna with the Village Network for about a month now. And we actually got quite a good feedback on Alexa and for those with dementia. So it's really the impact of using the smart technology in the home. Oh. And so really it's when I thought of knowledgeable aging, it was, we don't want to be just generic, because you can't just say what is dementia, because there's so much to it. And it's not just dementia, it could be any topic that impacts the aging population. So, but that one specifically really just talked about the smart technology in the home, where things are going, and how it impacts, like I said, the family members and the caregivers. So that was one of our more popular ones.
Right. Right. And that was one of the topics that we discussed most recently with our Orange County Sheriff's Department. So yeah, you're hitting on all the topics for sure. Where are you based?
We're in Washington, D.C., so I'm a little jealous. We don't get your weather. So if you could do me a favor, just put that in a bottle and send it here every week or so. That'd be great.
Yeah, Washington, that's on the other side of the world at this point here.
Absolutely. And so just so you know, our live webinars every week are Tuesday through Thursday. So if somebody there at Laguna is up at 9 o'clock and having a cup of coffee, join us for a live webinar from 9 to 9:30. But yeah, that's what we do, is we provide 30-minute segments. You can get in, you can ask questions, provide feedback, and we welcome any and all questions you can have.
Okay, that's awesome. That's great. Now, they're 30 minutes in length, and we air them on Wednesday from 4:30 to 5, correct?
Yes, that is correct. Yeah, like I said, we've been on for about a month now, so we're doing everything we can to provide relevant, original content every week. And right now, I think we've about 15 more in the queue. So, and we're producing content every day, and we're just excited to have the relationship with Laguna going forward.
Well, awesome. And then one last thing, tell me how we can find you.
Oh, well, www.knowledgeableaging.com. You can go there, you can see what we're doing. I'm a visual person. I love to be able to just watch. So if you want to go to our YouTube page, type in Knowledgeable Aging, subscribe, and then of course we'll add in the live webinars there. And then we also come in the smaller clips. So if you want to watch something for maybe 2 to 3 minutes, those go on there as well. So we pretty much update the YouTube page at least 6 days a week.
Excellent. Well, gosh, I really appreciate you taking the time to spend with me. Is there anything else you'd like to let us know?
The one thing I heard recently that I really want to make sure people understand is you don't have to suffer in silence, especially with everything we have going on with COVID. Everybody's impacted in some capacity, whether it's mentally, physically. If you've got something going on with a family member, a friend, or yourself, don't suffer in silence. Reach out to somebody, because I promise you there are individuals out there, organizations that are willing to and very much interested in helping you in some capacity, but you're not alone. And so, right now, mental health is a big concern with individuals. So once again, just don't feel like you're going through this by yourself. Reach out to somebody. That's my recommendation for right now.
That's great. And then one last question for you. How are you doing?
Thank you. I'm in remission, so I'm very thankful for that. Obviously with COVID, I don't get out of the house too much. So, it is what it is.
A lot of time to produce content.
Absolutely. So the wife, I'm sure, just loves having me home all the time. So,
Oh, well, I'm very happy to hear. Congratulations, and congratulations on the new show.
Well, thank you so much. We look forward to working together further.
All right. We'll talk to you again. Thank you.
All right. Bye-bye.
And we'll be right back after this.
At the Memorial Care Breast Centers, our sole focus is to save lives through annual mammograms. We've implemented the following safety measures to keep you safe during your appointment. All patients are screened upon entry and will be asked to wear a mask. Waiting areas and dressing rooms have been rearranged and are being disinfected more frequently. Appointment times are staggered for social distancing. All staff are screened upon entry and wear appropriate PPE. Our standalone breast centers are located throughout our communities, and with easily accessible locations from Long Beach to Rancho Mission Viejo, we're here for you, close to home.
Back. All right, well, if you are a resident of United or Third, you are going to have a welcoming. It is a virtual one for new residents. Now, today, United Laguna Woods Mutual is at 4:30 p.m. And if you would like to participate, then you just go to the website, lagunawoodsvillage.com, and you would be able to type in new resident orientation. It'll bring you right to that. You can get all the information there. So, and the one for Third won't be until Friday, November 29th. So as the time gets closer, we will tell you about that one. All right, the I Am Me First Holiday is happening tomorrow, and that is with the Theater Guild. And so if you would like to participate with that, you can go ahead and send them a request to theaterguildlw@outlook.com to get the link, which will be the Zoom link, to be able to follow along while people are doing their I Am Me Holiday Edition, read-alouds. And then the Theater Guild will also be having their Johnny Carson Show 2020 edition this Saturday at 2 p.m. There is no rain in sight, so it should be a wonderful afternoon, and that'll be at Clubhouse 5 parking lot. But don't forget to get tickets. It's $5 per vehicle, so you do need to have that piece of paper showing that you paid before they let you in, and you can get that at ActiveNet. And then one last thing, the Rummage Sale this weekend, as the gals told us about from the Florence Sylvester Senior Center. That is going to be this Saturday, November 21st at 8 a.m. to noon. But if you have items that you would like to drop off, you could do that tomorrow, Thursday, from 1 to 3 p.m. All right, let's take a look at our weather. As I mentioned, it looks quite lovely this week and right through our weekend. We're not looking at any clouds and rain, so should be pretty nice. 70-53 tomorrow, 70-54, 70-51, and then the weekend is 72-52 and 71-50. So definitely pleasant throughout the whole week. Have a great day in the village today. We'll see you again tomorrow right here at 9 a.m. Of course, you could always rewatch our program at 12:30 and 5 p.m. Have a great day. Stay healthy. We'll see you again tomorrow. Bye-bye.
Hi, I'm John Bowser-Bauman. You probably know me best as Bowser from Sha-Na-Na, but I'm also president of Social Security Works PAC. And you know, when I'm in Laguna Woods, I always watch Village Television. Grease for peace.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.